This is the What's It All About Immunisation flipbook, which I believe will be a really fantastic resource for you to use, having complex conversations with parents and patients about immunisations and why they're so important. Discussing immunisations can sometimes be complicated and complex. People come to you with worries and anxieties about when to have the vaccines, whether there may be side effects, whether they should have the vaccines or not. So this flipbook has been developed to help you have guided, evidence-based conversations about all the immunisations.
So we saw a need for something for clinicians to use to talk through the complex conversations around vaccinations, particularly for those that are vaccine hesitant, to support with the major changes to the childhood immunisation routine schedule, the introduction of the MMRV vaccination programme, and also the fact that across London, vaccine coverage is low and vaccine hesitancy is high.
Firstly, you don't need to use a flipbook in every consultation. Because it's on your desk and accessible, it means that you can use it as and when you need to, depending on what conversation you might be having with the patient. By having it on the desk and where it's so colourful, it means that patients who may not have come in for their vaccination, they might be interested in it, and that can create a little more for conversation, making every contact count. The flipbook has tabs on the side here, and it will relate to vaccine overview, vaccine safety, vaccine content, and vaccine information.
I'm going to walk through some of the pages now. The flipbook starts with an overview of the routine childhood schedule. This helps to support parents when discussing the vaccinations, because they can sometimes feel overwhelmed by the number of infections we're vaccinating their children against. The flipbook covers lots of topics relating to vaccines that often come up in consultations, particularly with patients that are looking to find more information. So I'm going to show you a few of my favourite pages now. The history of vaccines is a popular one. This just walks us through the development up to the current day. The most common one is the MMR and autism, which we've tried to structure so that patients see we have this as a ready resource on our desks that we can talk them through, and hopefully that engenders some trust in what we're saying. Sometimes patients will be concerned that the vaccines in themselves can cause the disease, so we have a section on vaccine safety showing things that the vaccines do and do not do. Within other vaccine information, we found this page very useful, which illustrates what is actually within the vaccination. Obviously, the main ingredient in vaccines is water, which can be reassuring to lots of patients, but then it goes through all the other ingredients and the relative quantity of those ingredients in things that we would commonly feed our children and one another without having anything to worry about. The flipbook has a simple format and presents information in a simple way that helps patients to understand the information without being overloaded by it. So clinically, I've found the flipbook really helpful within the consultation. I've found having a material resource with everything explained so clearly has really helped build trusting relationships with parents, much more so than when I look things up digitally and share with them. I found that the response to having it written down and having the illustrations has been very, very warmly received.
It can also be a tool where somebody might be interested about vaccinations for somebody else in their family, such as their elderly grandparents or even their grandchildren. I found by using this that sometimes you get patients who may not come in for their immunisations. I've often had diabetic patients who've come in, and actually by having this book, it's been an encouragement for them to then be interested in their pneumonia vaccine, for example, that they were not previously interested in. I've also found it really useful beyond patient conversations. It's a useful tool for training GP registrars, new to practice nurses, and care navigators. Each practice has been given 5 booklets. Think about where you want to put these. We want them to be in the clinical rooms where lots of patients are coming in and coming out. We don't want them sitting in the waiting room, because these books are meant to be used as an aid for having clinical conversations, not for patients to take home or to sit and read on their own.
This has been something that we've worked on for over 2 years now, working closely with clinicians, public health colleagues and immunisation experts The prototype version of the flipbook was trialled across 25 GP practices. So the feedback shaped everything that you see here: the structure, the language, the visuals, how it's used in consultations, even the fact that every GP practice is receiving 5 copies of this flipbook.
The flipbook has been developed to complement other resources we have to help share with people when we're having these discussions, such as the vaccine preventable diseases complications and symptoms, and other information about the diseases that we're trying to prevent.
I really hope that you find the Immunisation flipbook a useful resource as part of your day-to-day practice.